not in a tropical country, it's not something we're used to. So MERS in Saudi Arabia, the Zika virus in Brazil.
We have suffered several Ebola epidemics, which are quite much more scary than this.
A family doctor says there's a lot to learn from physicians all over the world battling COVID-19. And she's featuring them on a new podcast about their pandemic response.
As part of the Bizor Center, which focuses on family medicine in different countries, Dr. Gibson wanted to go beyond the research papers and protocols and hear stories. So far, she's heard in Saudi Arabia, which dealt with the MERS virus previously, had an aggressive social media campaign for public education, whereas a Brazil doctor noted politics clashed with healthcare officials.
Drug dealers in the favelas, the slum outskirts of the cities, they're the ones enforcing curfew and physical distancing because they don't think the government is protecting the community.
Why do you think Uganda hasn't detected a case yet?
Uganda has had some long-term experience in the management of epidemics.
This podcast features a doctor from Nigeria working in Australia.
In the midst of all of this, I've had people going to the beach, and even as recent as this week, and I'm wondering, is this their way of coping?
Dr. Gibson says she feels for physicians who've never had to work with a pandemic response before. And as more evidence about COVID-19 surfaces and government guidelines evolve, she hopes officials are open to what's happening beyond our borders.
We have to be experimental and we have to be nimble and adaptive because we're learning so much about the virus. And everyone doing that around the world helps us all collectively.
In Calgary, Crystal Ladares, City News.